Right, Tracy, so what is a permanent makeup treatment?
A permanent makeup treatment is the procedure of infusing hypoallergenic, safe, sterile pigments into the dermal layer of the skin, where they create a shadow of colour that mimics the appearance of makeup or a natural enhancement. The results, they last for approximately 2 to 3 years, and the treatment, it originated from reconstructive surgeons when they were chromatically reconstructing people's faces and their bodies to complement their reconstructive surgery. Nowadays though, from a medical standpoint, a natural enhancement, we have very skilled technicians who are able to change the appearance of people who have been affected by certain medical conditions such as alopecia or scarring.
And what can people have done? What sort of treatments are available?
Greg, we offer 3 different kinds of aesthetic treatments here at Natural Enhancement. That is for the eyebrows, for the eyes and for the lips. So let me go through them all for you. The brow enhancements, we're able to create really natural looking eyebrows, even if your hair growth is sparse or if you have no hair growth at all. And then if you've got hair growth and you're unhappy with your look and you just want to perfect your eyebrow, then we can give you the ultimate eyebrow makeover with our signature treatment, Brow Revival, which will perfect your brow shape and define the colour. This can be done in 2 ways. Firstly, with a colour mist, which is a mist of colour which is placed underneath your hair growth, or we can create the illusion of ultra-fine, delicate hair strokes. We also have what we call our Stay Perfect eyeliner, which is a must-have essential if you want to define your eyes and accentuate their colour. And that can be as understated as you want, or it can look like a full makeup as well. Our specialist lip perfection treatment involves the use of digital state-of-the-art equipment that allows us to put a tint of colour across the complete body of the lip. We are able to create ultra subtle enhancements, so the complete lip has a tint of colour across it, and that can be done as a uber natural look, or if the client wants the look of makeup, that can also be achieved.
What are the medical tattooing procedures for?
Medical tattooing can be used to treat irregularities in the areola that have occurred from surgery after mastectomy during the breast reconstruction process, and also after breast uplift and breast reduction surgery. Now, this is not a new concept. It's been used by reconstructive surgeons for many decades. Nowadays, however, surgeons tend to pass the skill over to specialist technicians who can create an illusion of a 3D areola. Medical tattooing can be used to camouflage scars long term by infusing micro points of pigment into the skin. We use multiple colours to create the tonal variance of normal skin. Scars need to be at least 1 year old, and they must be lighter than the surrounding skin. We can use a specialist technique called multi-trypanic collagen actuation, shortened for MCA. And what we do here, we dry needle the area with the tattoo device, and this has the effect of softening taut scars, and clients have reported back to us that they feel that they have more mobility in the scar. So with the treatment of vitiligo, it's very similar to scar camouflage. We're repigmenting hypopigmented skin, and again, a skilled technician can use multiple shades to create the tonal variance of normal skin. Vitiligo needs to be in remission for 1 year for us to go ahead with the procedure. Otherwise, the injury to the skin may create a spreading of the vitiligo. And we found difficulties with inserting pigments into the skins of clients who've got darker skin. We find that we cannot get the density of the colour required, so I really would only recommend it for fair-skinned clients. Also as well, we need to do just small areas, really, because a big area The discomfort, the commitment and the expense really would make it not suitable for treatment. Medical tattooing as a solution to hair loss is achieved by putting micro points of pigment into the skin to mimic the effect of a new hair growing out of the follicle. It can be used for, in the case of women, for thinning hair, and also for men for thinning and balding. It can be used to conceal hair transplant scars. It can also conceal scars as a result of surgery and injury on the scalp. If someone suffers with a condition called trichotillomania, where they're habitually pulling on the hair, it can be used to camouflage that hair growth, or hair loss rather, as well. The areas that can be treated are the scalp, the beard and moustache region, and also in the pubic region for women who've had cesareans.
And who actually benefits from having a permanent makeup treatment?
Basically, anybody who wants to improve their appearance are going to benefit from permanent makeup. Our youngest client is 18 and our oldest client is 87, so it covers a complete spectrum of people. At Natural Enhancement, we have very talented specialists who can create results that are virtually undetectable, and therefore permanent makeup is also suitable for men. So you're going to benefit from it if you want to look good 24/7 and you've got a really busy lifestyle. If you're an outdoor sporty type and you want a long-lasting, durable makeup that can stand up to your activities. Perhaps you want to preserve your looks and you're looking for an enhancement that's going to make you look younger, then permanent makeup is a definite option for you. And if you find applying makeup a little bit difficult because your eyesight has deteriorated or your hand has now become unsteady as you've got a little bit older, then permanent makeup is perfect for that situation. And if you've lost your brows or you're losing your brows and your eyelashes due to chemotherapy, alopecia, thyroidism, or just the aging process, then we can restore the brows and give a definition around the eyes.
And Tracy, is there anybody that you wouldn't recommend having a permanent makeup procedure?
Yes, there are some cases in which we wouldn't recommend a client to have permanent makeup. One of those would be if the client was under the age of 18, and that's due to the legalities of tattooing a minor. Other certain medical conditions that would contraindicate a client having a procedure would be pregnancy and breastfeeding. That's due to the absorption of the anaesthetics that we use, or the numbing agents that we use during the procedure. Diabetics who are on insulin would not be able to have the procedure, and that is due to the poor healing. People who suffer with the HIV virus because their immune system is compromised, and if someone currently had hepatitis B or hepatitis C, we would not be able to go ahead. Clients who have had an epileptic fit within the last 3 years would be contraindicated to having the procedure. And if you had an inflamed skin disorder over the area, for instance, eczema, psoriasis, or dermatitis in a localized area to where you are having the procedure, we wouldn't recommend that we go ahead with the procedure. Again, that is just in the localized area. If a client is using Accutane, which is a medication that treats acne, you would have to have completed the course of Accutane 6 months before we could do the procedure, because the skin is so sensitized when they actually take that medication. And if people are taking aspirin on a daily basis, ibuprofen on a daily basis, anti-inflammatories, the use of antiboosts, you would have to speak to your GP, and he would have to alter your medication program so that they could reduce the intake or stop the intake 48 hours before and 48 hours afterwards. This is because the healing of the skin and pigment retention is affected. We've got many clients who do take these medications and they do go to their doctors, and we have very, very successful results with them if they follow this program. If a client has had previous healing complications, then we would always ask for a doctor's consent. And if someone is going to have an eyeliner procedure, if you've had ocular herpes or you've got cataracts, then the treatment would be contraindicated. You've got any medical condition that you are concerned about, discuss it with your technician during your consultation, and she'll settle your mind. She'll advise you what's appropriate to do so that you have a successful treatment, or if it's best that you don't go ahead with having the procedure.
So does having the treatment hurt?
We always get asked this question. The use of effective numbing agent makes the discomfort similar to the discomfort you would experience if you were having your eyebrows tweezed. If you feel your pain tolerance is poor, then your specialist will keep topping up the numbing agent, avoiding you becoming stressed and uncomfortable.
How does one take care of their permanent makeup after treatment?
Well, your specialist will give you very clear instructions as to what you should and shouldn't be doing following your treatment. She'll also send you home with aftercare balm, which is a soothing balm which will help in the healing process and help to promote maximum pigment retention in the area. Going right back to basics, the most important thing that you do is that you don't touch or pick the area at all. We'd also recommend that for the first 3 to 4 days that you avoid applying any normal makeup over the top. Obviously the skin is open, that will help to prevent any infection into the area. Obviously if you're having one part of your face treated, you can put makeup on the other areas, that shouldn't matter, and that will allow you to get on with your normal daily activities. It's also imperative that you avoid any direct sun exposure for the next 2 weeks following the treatment, and this will help to prevent further problems down the line in terms of long-term pigment changes. Very important as well that you keep the area dry. So say for example if you're having your lips treated, what we'd normally recommend that you do is that you apply a thin layer of Vaseline to the area whilst brushing your teeth. The same with the brows, likewise if you're washing your hair, if you apply a thin layer of Vaseline to there as well. For the next 2 weeks, what we'd recommend that you do as well is that you avoid any facials, steam rooms, saunas, jacuzzis and any other form of tanning treatments. So if you do suffer from cold sores, what we'd normally do is get our technicians to talk you through the process in order to prevent any cold sore outbreaks following your treatment. But anyone who suffers from cold sores will know it's quite easy to get an outbreak if you're stressed or if you're tired. With permanent makeup, it doesn't actually cause cold sores, but if you suffer from them already, it can obviously stimulate them to come out. What our technicians normally recommend is that you just take some medication, and this should prevent any further outbreaks during the healing process. In terms of looking after your treatment in the long term, once the area is healed, we recommend that you use a high factor sunblock on the area daily, and that's just on the brow and the lip area. Once the area is healed, so the first 2 weeks, if you do this, this will help to prevent any long-term pigment fade due to sun exposure.
Tracy, are there any side effects?
Basically there's no long-term side effects, but there are some what we call short-term side effects, and that would be the minimal redness and swelling associated with the treatment. Lasts for no longer than 36 hours, and in fact with eyebrows it generally diminishes within the hour. You'll notice once you've had the procedure done that it will appear 50% darker immediately afterwards, and this normally lasts for 4 to 10 days.
And will people notice an immediate difference?
Yes, of course. People will definitely notice the difference. Whether you choose your permanent makeup to be minimalist or the full makeup look, it's going to change your physical appearance, and it will improve your self-confidence.
And when a client comes to Natural Enhancement, can they choose what colours they want to be used?
Basically, yes. Your specialist will give her professional opinion to you during your consultation. She's going to analyse your natural colours and she's going to select colours for you that complement your natural colourings. But what you have to remember is that the colours are translucent, and so your natural colourings are going to shine through, and so even if we create your perfect shade for you, when we infuse it into your skin, it may reflect back a slightly different shade. So with this in mind, it means that sometimes your specialist has to work within certain parameters, but she will endeavour to create the look that you want.
And how long will it take?
Generally, we schedule 1.5 to 2 hours to create your enhancement and give you a thorough aftercare briefing. We will also schedule a 1-hour appointment 1 month later to allow us to check everything is perfect and to make any minor adjustments that may be required. The follow-up appointment is included in the initial price.
Can people still wear their conventional makeup over their permanent makeup?
Yeah, by all means, a lot of people will do this. As long as the area is healed, it's fine to wear conventional makeup over the top of the permanent makeup. In fact, a lot of people would do this if they wanted to change the colour or to change their look. A lot of our clients actually come in and just request for a very discreet enhancement, and then obviously that will form the basis to put conventional makeup over the top.
And what type of permanent makeup is anti-aging?
Well, in my opinion, all permanent makeup can be anti-aging. One of the main things we notice when we do age is that we tend to lose a natural definition or our natural colourings around our features. In our early 30s and 40s, we start to notice the lip colour will start to fade and you start to lose your natural lip contour. The brows also get sparser and less populated with hair, and the eyelashes will thin out and get paler as well. This is a problem which can be addressed by all type forms of permanent makeup, and this will help to add the definition back to your features. Because come on, let's face it, who of us feel our best without any makeup on? If you are thinking about getting a surgical brow lift, a great idea is to try permanent makeup first of all. Our technicians can place pigment across the brow and elevate the brow arch itself, and this gives a really nice effect. It helps to really open up the eye and give a lifting effect.
Does it matter if somebody has sensitive skin?
No, not at all. Permanent makeup is actually a perfect solution for people who have sensitivities to conventional cosmetics. Our pigments generally are very well tolerated by the skin because of the purity of the ingredients. Our pigments are also sterile and they're certified to European standards, all of which mean that they're very safe.
And Emily, is permanent makeup similar to, say, having a tattoo?
Well, yes, it is similar in terms of the application process itself. However, with permanent makeup, the pigments are not applied to quite as deeply into the skin, and also they're purposely made to fade. All of this means that you won't have the permanency of a regular tattoo.
So once applied, Tracy, how long do these procedures actually last?
We're asked this question regularly, and it's dependent on a number of variables, but the two most important points are the colour choice and exposure to the sun. Now, with colour choice, your softer neutrals tend to fade faster and your denser darks tend to last longer in the skin. So if we created a honey blonde eyebrow, that would fade faster than perhaps a black eyeliner.
Does the sun affect permanent makeup treatments?
During the healing process, we ask that you protect your enhancement from the sun to prevent colour change complications. But long term, we ask our clients to wear a sunscreen over the area, SPF 30, because the sun does prematurely fade permanent cosmetics. So every 15 months, we ask our clients to come back into the clinics. We send them out a reminder, and they have what we call a colour boost maintenance procedure, and this keeps the enhancement looking fresh. Every 15 months they come back in, and we charge that at a significantly reduced fee.
And how is the treatment carried out?
Our treatments always begin with an in-depth consultation, and that allows us to assess the medical background of the client, see if they're suitable for the treatment, and also to understand what their expectations are of the treatment. We will then do what we call a colour consultation where we analyse their natural colourings and choose the best shade for them. We'll also look at their facial structure, and so that we can choose the best position for the permanent makeup and what is the best shape for them. Because client comfort is of the utmost importance to us, we will apply numbing agents before we actually carry out the infusion process. And we also pre-draw the look in conventional makeup before we infuse the colours into the skin, so the client has the opportunity to see exactly what it looks like before the pigments are infused into the skin. Now we infuse them into the skin using an electronic handpiece, and that is traced precisely over the pre-drawn template. Our clients describe it like having their eyebrows tweezed in terms of discomfort, and usually the procedure takes about 1.5 to 2 hours. We also offer a complimentary tune-up 1 to 3 months after the original application, and that just allows us to fine-tune anything, make any alterations that the client requires.
What would a client need to do before an appointment here for natural enhancements?
Because your image is a personal reflection of yourself, it's really important that you think about what your expectations are with your permanent makeup. Obviously, during the consultation, your technician's going to give her professional advice, but it's good to have a general idea of what you want as well. It's a good idea to come in wearing your normal makeup so you can communicate the looks that you like to your technician. And for best results, it's really important that the skin is not sensitized. So we ask clients not to have medical grade peels 1 month before coming in for their procedure, and also to avoid Retin-A, that's an anti-aging preparation. We also ask them to avoid using AHAs such as glycolic acid, again due to the sensitivities, for 2 weeks before their procedure. With regard to sensitivity, we would also recommend that our clients don't have hair removal procedures in the localized areas using waxing, electrolysis, IPL and laser. And if you're having an eyebrow procedure or an eyelash enhancement, we ask you not to tint the hair, because that will sensitize the skin and also affect the look when the therapist is assessing your needs. Also, avoid eyelash curling treatments and eyelash perming treatments for 2 weeks before having your procedure if you're going to have an eyelash enhancement, and avoid wearing false eyelashes and eyelash extensions when you come for your treatment, because when we're running the pen through the eyelashes, it can snag on the artificial lashes and tug and pull and put your natural lashes under stress. Obviously, at the close of the treatment, when the skin is healed, you can reapply the eyelash extensions as normal. With regard to medications, if you are on long-term blood thinners, then your specialist will ask you to go to your doctor and perhaps alter your medication program for a couple of days before you come in to have your procedure, so that will enhance the healing process, and you'll retain more pigment when the pigment is infused into your skin. And for 2 days before you have your procedure, we will ask you to avoid taking aspirin, ibuprofen, anti-inflammatories and alcohol, because these all slow down, they thin the blood, they slow down the healing process and therefore affect pigment retention in the skin.
Tracy, what happens if a client isn't happy with the procedure or the treatment that they've had done?
During your consultation with your specialist, careful planning and good communications between the two of you will avoid this situation. Obviously, you're going to explain the look that you want, and she's going to give her professional advice, and therefore these situations are avoided. But if a client did find themselves in the situation where they were unhappy with the results, we can over-tattoo the area with removal agents, and these accelerate the fading process and lift the pigment out of the skin. However, we cannot do this for eyeliner procedures.
And can people have permanent makeup applied in the privacy of their own homes?
We would not recommend to have your permanent makeup applied in the privacy of your own home. To meet licensing requirements, we have to maintain very strict hygiene standards, and a domestic environment would not achieve those standards.
So as a client ages, will the makeup still look as good as it did when, say, you first had it done?
Yes, and that's because unlike a conventional tattoo, permanent makeup is designed to fade. As long as it's inserted into the skin at the correct depth, it will fade over time, and we actually use that fading process to get it to work for you. If you have an enhancement when you're in your 20s and your 30s, it probably wouldn't look appropriate if you're in your 60s and 70s. So we're actually using the fading process to our favour. For our clients who come in for their 15-monthly colour boost, the fading process allows us to adapt your permanent makeup so it's completely appropriate for your natural colourings and your facial contours as you get older. Basically, if it's applied correctly, permanent makeup will always look good as you age.
And can people get their permanent makeup wet?
During the first 7 to 10 days of healing, we ask you to limit the exposure of your permanent makeup to water. Washing your face and hair and brushing your teeth, of course, can continue. Just apply a thin layer of waterproof Vaseline onto your enhancement.
Can a client go back to work straight after having permanent makeup applied?
It's really a personal choice, Greg. The main concerns that you're going to have are redness and swelling. They are minimal. They last no longer than 36 hours. For eyebrows, they dissipate within the hour. The main thing that you're going to be conscious of is that their enhancement will be about 50% darker than the actual healed result. This is relational to the light scabbing that they get or the dry flaking skin. And as that lifts out of the skin, it lifts the excess pigment with it, and that generally takes about 6 to 10 days to occur. So in answer to your question, Greg, they can go back to work. Their colleagues probably will think that they're wearing their makeup a little more heavier than normal.